Hi, welcome to Wellness Woodbridge. I'm your host, Ann Mazza of Vito Mazza Salon and Spa and Hair and Scalp Wellness. So excited to be here today. We are at a wonderful healthcare facility right here in Woodbridge that has an array of services. I am with the owner, Sean Basinger, and he's going to tell us all about the services that you provide. So excited to be here with you today. How's it going?
Thanks for coming. Good. So we are a multi-specialty healthcare facility. What that means is we offer a variety of specialties to any patient that might need to come in for care. We range from physical therapy to chiropractic, acupuncture, occupational therapy. We have pain management doctors and a vascular surgeon on staff.
Wow.
So
that's a lot.
One-stop shop for all your healthcare needs.
One-stop shop,
Yes.
Which I think has got to be convenient for all of our Woodbridge community. That's
Absolutely.
Excellent.
You know, being born and raised here in Woodbridge Township, you know, we opened up this office back in 2018. We've been servicing the community for the past 5 years and have been able to help a lot of people in that time.
You're in a great location right
Sure.
off of Amboy Avenue here in the old Woodbridge Deli spot.
Yes.
But what a transformation.
Sure.
I can't believe that I'm standing in the same space. It's beautiful.
We did a good job, you know, so instead of getting a sandwich now, you can get an adjustment, you know, instead.
Absolutely. We have plenty of places we can go for a sandwich,
Sure.
but it's so great to be here and to see what you've done with the space. It's very clean and open and airy.
Yeah.
And so you do the physical therapy would be your number one?
So by trade, I'm a physical therapist. So I started Health and Fitness Professionals about 8 years ago now. In 2018, like I said, I brought one of our locations out of 4 here to Woodbridge Township, and yeah, we provide, you know, high quality care, which kind of sets us apart from a lot of other places that we're able to actually spend one-on-one time with our patients. So patients that come, they're not stuck in a mill with 100 other patients in here waiting for a therapist to come. We are able to spend the one-on-one time with the patient, which kind of sets us apart from a lot of our competitors.
Excellent. So you have 4 locations.
Correct.
And at those locations, do you do the same
All the
services?
same. So all the same in each location.
And your concept is to bring this client in and be able to facilitate to whatever their needs are depending on their
100%.
specific injury.
What sets us apart from a lot of places too is we don't take a cookie cutter approach to how we treat a patient. A patient that comes in with, say, low back pain is not going to be treated the same as every other patient with low back pain. Everybody's different. Everybody's body's different. Everybody responds different. And more importantly, everyone has different goals. So we make sure to take those goals into consideration on what is the patient actually trying to get back to doing. And we take that and make it a part of their treatment plan. Now, whether they're seeing our physical therapist, whether they're seeing our chiropractor, our occupational therapists, our acupuncturists, or a combination of all, we take that approach to individualize our treatment plans for our patients. So an example of a patient that might come in with typical neck pain or headaches, which are very common for our everyday lifestyles, might see Mike here, one of our physical therapy assistants. And what he's doing now is just gently stretching the muscles, providing some relief to the base of the skull to kind of help relieve pressure, which will help alleviate any kind of headaches that the patient might be experiencing, and also help loosen up any tight muscles that also might be encompassing and causing any kind of pain that she might be having.
Wow, so most patients would be coming maybe how many times a week?
Depends on their condition. So typical physical therapy is usually 3 times a week for 4 weeks, which is a majority of what we see, you know, for our patients. But everyone's schedules are different. So, you know, I'd say on average we see anyone from 2 to 3 times a week.
Excellent. And are the scope of most of those services covered under insurance, or how does that work?
For the most part, and we do a really good job of working with our patients to make sure it's also cost efficient, especially with times these days. We want to make sure that care is affordable for our patients, so we work with them in every aspect we can to make sure that not only we're getting the insurance to cover it, but we're also trying to offset a lot of their out-of-pocket costs.
Wow, that's absolutely very important in this environment,
yes.
For sure. So you do the physical therapy, and then let's talk about the acupuncture a little bit. You have
Sure.
someone on staff doing that, which is
Yes, we do.
obviously non-conventional, but can be extremely effective.
I love it. I do it once a week for myself.
Yes.
So acupuncture is great to treat all sorts of muscle conditions, any kind of pain conditions. Also outside the box, it helps with smoking, people trying to quit smoking. It helps with dietary problems, stress relief. There's a whole plethora of actual conditions that acupuncture can treat. We also provide acupuncture services to our patients as well. Here is one of our acupuncture rooms where patients will receive care for about a half an hour on one of our massage tables and receive needling and cupping treatment. Part of our chiropractic physical therapy and especially acupuncture treatment is also cupping, as you can see here. So This is our acupuncture room where a lot of our patients will come in and receive needling, and in addition to that, also cups, which helps increase circulation to the area and help loosen up any tight muscles or adhesions that someone might have.
I have done it myself, and it has been very effective for me after surgery, post-surgery, but also just hormones and everything.
Sure.
It's a wonderful, non-conventional form of medicine. That could be great. That's wonderful. And that's covered under insurance as well?
Yes.
Excellent.
And like everyone too, we always check insurance plans before you come in. So typically how it works is if a patient makes an appointment, we take down all their important information, we take down their insurance information, their personal information, and then what we do is we call our insurance companies ourselves to verify all their benefits to make sure the patient knows exactly what they're getting into before they come to see us here. So no one's stuck with a surprise bill or anything like that. So everything is explained to the patient before they come so they know what they're getting into. Explain
to me a little bit about what occupational therapy is and like what the difference is between that and physical therapy.
Sure. So occupational therapy really kind of focuses a lot on upper extremity, lower extremity, and really return to function, which is very similar to physical therapy. They specialize a little more in upper extremity than, so arms, shoulders, hands, cervical conditions, a little more than our physical therapist. So we kind of take an approach when a patient comes in to decide if they do not have a script, which we don't have to always have a script to see a patient, we decide who's going to be the best fit for our patients. So if the patient's coming in with a shoulder pain or shoulder injury, typically off the top of our head, we're going to think for our occupational therapist at first might be a good fit for that patient to see. Very common with patients with neck pain will be some sort of arm weakness, maybe some sort of tingling, numbness that might start from the neck and radiate down the arm. This is where Brooke, one of our occupational therapists, comes into play to kind of help restore some of that strength, relieve some of those symptoms, and work with our patient in conjunction with our physical therapist.
So like an elderly person who maybe has like loss of muscle, not able to get up and down from a chair.
Sure. So
that would be occupational?
Both. So physical therapy really helps with mobility more than anything. So helping a patient, get up and down on a chair, performing stairs, being able to walk around their neighborhood, walk around their home. Occupational therapy would focus more for an elderly patient on, can they get their clothes on? Can they get dressed? Are they able to feed themselves? Are they able to wash themselves? So a little bit of differences, but correlates to complete care with the patient, essentially.
And all the services are here in-house?
Correct.
I know that you have done some work maybe with the sports teams in town?
Sure.
Or?
We've worked closely with the football team here at the high schools. I've done talks at the different high schools too for their medical clubs, and we try to give back as much as we can to the community, and every school around here and every resident essentially knows our doors are always open.
That's excellent. And I'm so glad, like when I met your staff, I had met them at a community event, and we talked about coming and highlighting this beautiful facility. You've been here since 2015.
So 2018 in this
2018, yeah. Excellent. But 2015 you opened, I guess, started the company.
Location in Scotch Plains.
Wonderful. And, we just tried to get in here so that we could highlight it, but I really didn't know you were here. I'm so glad that, we can get this out there on TV 35 so that our community does know that you're here and that you offer this array of services.
Oh, of course.
Really.
We love to give back, and that's what we're here for, to help anyone that might be in need.
Yeah, I want to highlight a few more of the services. Sure. Acupuncture.
Chiropractic care.
Okay.
Yeah, we don't have any of our pain management doctors here today, but I don't think you'd be looking to get an injection at this case.
Yes, no, but so you have the pain management doctors here as well.
Yes. So we do all sorts of, we do epidurals, we do set injections, trigger point injections, joint injections. So someone's knees bothering them and they need a cortisone shot, we do that here in the office as well.
Oh, that's excellent.
And we also recently have started offering vascular screenings. During the pandemic, a lot of blood clots started to arise. So I brought on a vascular surgeon that comes, and now we screen our patients just to make sure they're safe in that aspect, and that there's no other arterial or venous issues going on with the patients as well.
That is very insightful.
So yes, trying to make sure our community is not only taken care of, but safe as well.
And chiropractic is definitely something that, can be so helpful.
Oh, sure.
To a person's physicality care and everything.
Oh,
so
absolutely.
Who provides those services?
So we have Dr. Phil is one of our chiropractors here at our practice. He's here in our Woodbridge location, and he works well along with our team. So Again, a lot of our patients like to see multiple providers. So we, for example, we might have a patient come in, see Dr. Phil for an adjustment, which he would take our spine and make sure we're in alignment. And if not, he does an adjustment to make sure we're functioning properly and our spine is in alignment. And then they might go see the physical therapist to make sure that now that we're in alignment, our muscles are getting strengthened to keep everything where it should be. So Dr. Phil, our chiropractic physician, is assessing our patients' joint mobility within their spine to make sure that that's moving and functioning properly, so that way we can start to work on strengthening the muscles while the spine is in proper alignment. We do use a team approach a lot with our care to make sure that everyone's getting, not only the best bang for their buck, but making sure that they're taken care of in all aspects of their health.
Well, it's also challenging to keep that vision and, keep that client,
Sure.
On the right trajectory with their wellness plan. And it's wonderful that you are offering everything right here, but that communication is probably also something that is very important.
They're very important, and it's not for everyone. Not everyone has to see everyone that we have in this facility, but we have the options for the patient, and obviously depending on their condition, we give our expert advice and our recommendations on who we think would be the best fit, whether it's a solo practitioner or a team approach to their care.
Wonderful. So what is your vision for the future? Do you have any other thoughts?
We plan to continue to grow, continue to give back to our community. As a company, we'd like to continue to expand across New Jersey and see where the wind takes us.
That's excellent.
Yes.
Well, we're so happy you're here in Woodbridge. Very excited to highlight this beautiful place and, be part of your growth and watch you do that. So
Glad you guys came.
There's so much, going on, and it's wonderful. It's a wonderful service that you provide.
Thank you.